Hello everybody, welcome to my YouTube channel, Homoeopathy Super Sessions by Dr. Jarvis. Today we'll be doing the continuation of the previous video, Notes on the Miasms by Ortega, a brief summary. This time we'll be seeing in brief what is given in chapters 6 to 11. So chapter 6, it deals with the PSORA miasm. In this chapter, the fundamentals of PSORA will be discussed. Illness is an imbalance of the vital force. When the imbalance becomes far-reaching, it will invade the whole individual. When it becomes permanent, we recognize it as miasmatic. We define the miasm as a constitutional or the diastatic state, diathesis magra. So, in PSORA, Dr. Ortega says, PSORA is an imbalance due to deficiency. As in the previous video also, he has also said the same thing, or rather he has mentioned about it, that PSORA is an imbalance due to the deficiency. Psoric traits of a person are explained in this chapter. So the details of which are given on page number 63 to 64, you can go to that. And also the anxiety of the drug calcarea has been explained in great details. You can also go through the book. In the 7th chapter, regarding the psychotic miasm, psychosis is considered as the second HAHNEMANNIAN miasm. Its signs and symptoms are enumerated. In the miasm, we get pedunculated growths resembling figs are the characteristic value. They resemble the pathological condition of excess, escape, hyperplasia, ostentation, tumor formation, and acceleration. So out here, the psychotic miasm, we have the overgrowths, or we have excess, or we have exuberance, as discussed in the previous video. So out here, Dr. Ortega says, out here you will get pedunculated growths resembling figs. They are a characteristic indication of the psychotic miasm. And they resemble a pathology wherein it is considered as a condition of excess, or a condition to escape, or there's hyperplasia, hypertrophy, ostentation, benign tumor formation, and even acceleration. So when acceleration occurs, you get the different types of skin manifestations in the form of tumors, warts, papilloma, growths, etc. The joints are also affected, and the skin too. The miasm is a product of selfishness. So in this psychotic miasm or in psychosis, the selfishness is marked. Even illusion, delusions, and hallucinations are present. Pains are like his mental symptoms changing and erratic. So just like the mental symptoms which are oscillating, or which are wavering, or which are erratic, or which are alternating or changing, even the pains are changing, erratic, stabbing, and unbearable. He must always be on the move, changing position, finding another place. So there's restlessness. When the pains are there, the patient has to move, or patient is better by continuous motion, or changing the position, or finding another place to sit. So these are the actions of the patient which will help us to perceive the modalities of the miasm. The psychotic will typically wrap himself in a thick layer of fat. So the psychotic patient is naturally obese. It prevents him from eliminating the things which harms him. So because of this thick layer of fat, it becomes difficult for the body to eliminate the toxins from the body. It produces a lytic or a uric acid diathesis, as well as other forms of retention and accumulation within the great diathesis we call psychosis. So what happens? The toxins do not get eliminated. They remain in the body. They accumulate in the body. So it gives rise to a lytic or an uric acid diathesis, whereby you get retention, accumulation, and what we call it as the psychotic diathesis. Mentally, he is audacious, tends to flee or escape in fright. So mentally, whenever the patient is anxious, nervous, he tends to escape. He will not confront the patient or the person. He will try to run away. The pathology is full of accumulation in his bone structure and his skin. So the pathology is full of accumulation. It can be anywhere. but he specified saying that in the bone or the skin. So it can occur in the soft tissue, it can occur in the mucous membranes, the serous membranes, in the meninges, anyway it can occur. This gives rise to hyperglobulinemia, papillomatosis, arthritic nodes, callosis, swollen tonsils, ovarian and hydatid cysts. So just to give a few examples, Ortega has enumerated a few conditions. PSORA, syphilis combined with psychosis to produce dropsy, anasarca, formation of large tumors, and various degenerative organic hypertrophies, always with a tendency to expansion. So he said when the psychosis is there and when combined with the PSORA and the syphilis, you get many more pathological conditions like dropsy, anasarca, formation of large tumors, hypertrophies, etc. So the next chapter, chapter 8, syphilis as the third Hahnemannian miasm. So the most salient characteristics of the syphilitic miasm will be dealt with in this chapter. The Shankar's illness whose suppression endangers miasmatic syphilis, which is manifested from the interior to the exterior, will be explained. And syphilis, the third of the miasm, is, so to speak, the worst of the exterminators of the human vital force. So out here, the PSORA becomes mixed with psychotic miasm, and with syphilis, it causes degeneration. So when the disease is multi-miasmatic, PSORA gets intermingled with psychotic as well as with syphilitic miasm. So when it gets mixed up with the syphilitic miasm, it will cause definite degeneration and destruction. The syphilis miasm is symbolized by the words of destruction or degeneration. So the hallmark of the syphilitic miasm is destruction and degeneration. It is a violently destructive degeneration which is symbolized or represented by the ulcer. So this destruction and this degeneration can be seen on a skin lesion, namely the ulcer. A diathesis magna or miasm is in the constitutional state resulting from the arbitrary and unnatural suppression of Shankar's and ulcerous illness. So what happens? When does the syphilitic miasm take place? When the chancre or the ulcerous illness or the lesions have been unnaturally suppressed. They will give rise to the syphilitic diathesis or the syphilitic miasm. In the syphilitic miasm, we group all that is destructive in man's organ as well as in his mind. So the destruction and degeneration not only takes place on the physical body, but also takes place on the mental level. So mentally also, the patient will always think on the negative side. There will be destruction of thoughts, there will be clouding of thoughts, there will be accumulation of thoughts, and these thoughts will be put into action. In the psychotic miasm, you only get the accumulation of thoughts, and at that level only. The patient doesn't exhibit it or doesn't make it into an action. For example, if the patient has an incurable disease and the patient has a psychotic miasm, then the cloud of thought will be that he'll be very depressed, he'll be very sad. That's all. But in the syphilitic miasm, along with the sadness and the depression, there will be a tendency for suicidal thoughts, and the patient will try to commit suicide. So when you take the history of the patient, you will be getting this history that once or two times he had tried to commit suicide, but unfortunately he was sick. So therefore, in the syphilitic miasm, the destruction is not only on the mental level or not only on the physical level, but also on the mental level. Destruction and degenerative alterations will take place from the skin into his bones. So naturally, the disease will travel from the less important organs to the more important organs. So from the skin, mucous membrane, serous membranes, the bones, and the important vital organs. This will take place, or the internalization will take place if the disease has been suppressed. Mentally, the patient with a syphilitic miasm will be violent in reaction to his family and to the society. So violence is another hallmark of the syphilitic miasm. So mentally, he'll be violent, he'll have rage, he'll have anger. To whom? To the society as well as his family members. Hatred, the desire to kill or to commit suicide, to destroy, wickedness, fury, rage, or other characteristic features. Depression does not bring him to suicide or even to suicidal thoughts. He becomes extremely sad with absolute mental prostration. When happy, he is almost unhinged, and when afraid, almost the point of panic and terror. Nighttime intensifies all the complaints. So here you can see that when he's depressed, according to Ortega, it doesn't bring him to suicide or even suicidal thoughts. But he becomes very sad and there is a prostration of the mind. This is according to the Dr. Ortega. But if you read other books, this is not said. It has been said that when the syphilitic patient is depressed, he will have these suicidal thoughts and he will try to commit suicide. But however, Ortega may be of a different opinion. He's saying depression does not bring him to suicide or even to suicidal thoughts, but in fact, he becomes extremely sad with mental prostration or exhaustion. When happy, he is almost unhinged, and when afraid, almost the point of panic and terror. And nighttime intensifies all the symptoms. That means what? All the syphilitic complaints are worse at nighttime and better in the daytime. So night aggravation is marked in the syphilitic miasm. Now, chapter 9, illustrative material on the evident clinical manifestation of the miasm, taken from various colleagues who have assimilated our interpretation and application of Hahnemann's doctrine of miasm. So out here, Dr. Ortega has described 3 cases, predominantly psoric case, psychotic, and a syphilitic case. So you can read the page numbers for psoric 79 to 83, for psychotic case page 84 to 86, and for syphilitic case 87 to 90. 10th chapter, degenerative disease and the miasms. So degenerative diseases are always the outcome of the active miasmatic mixtures. So whatever degeneration or whatever diseases are there which are degenerative in nature, they are as a result of the miasm at the background, not only singly, but in a complex form. That means with a mixture, it's a mixture of the miasm. So the mixture of the miasms will make the disease degenerative in nature. The miasmatic diversification of the human mind, together with its civilization, brings on a condition favoring the degenerative disease. So, whatever thoughts are there in the patient's mind and the way he lives, it brings about favorable terms for the degenerative disease. Degenerative disease cannot be imagined in the absence of constitution of miasmatic disease. So, therefore, for a degenerative disease to take place, you have to have a constitution or a miasmatic disease. Without the miasm, the degeneration will not take place. PSORA is the perturbation of nutrition. Psychosis compels it to accumulate debris which should be eliminated, and syphilis causes it to degenerate. So, they says that in PSORA, you are getting a deficiency. So therefore, you will get lack of nutrition or undernutrition. And in psychosis, what happens? There's an accumulation of the toxins. Because of the fat, the toxins are not eliminated and it gets accumulated in the body. And in syphilis, on syphilitic miasm, it causes degeneration. Hence, miasms are responsible for all the true causes of all the imbalance, both dynamic and somatic. So, whatever imbalance is there on the dynamic level and on the somatic level, the miasms are responsible for it. The miasms can be in the latent state in which the person seems to enjoy good health. So, each and every one of us has the miasms, but we still enjoy a good state of health. Why? Because the miasms are in a latent state or a quiescent state, or they are sleeping, or they are in a slumbering state. The clinic of the old school declared to have normal health because the organs are functioning within the limit of the accepted pattern. Furthermore, this is confirmed by laboratory analysis. So, the old school or the orthodox school of medicine, they were of the opinion that they actually believed in the materialistic school. They did not believe in the dynamic school, nor did they believe in the miasms. So, they were of the opinion that as long as the patient is healthy, and as long as the functioning of the organs are also within its normal accepted limits, including the lab analysis, then we can say the person is said to be in a good state of health. But the man can still feel strange in the state of anxiety with the feeling of being oppressed by surroundings or out of harmony. But though the man is healthy or he seems healthy, the man can still have a strange feeling. Say, he'll say, doctor, I am not feeling well. I am very anxious. Or whenever I go out, I feel out of place or I don't feel like going out. But all these features, the allopathic or the orthodox school of medicine will say that they've examined the patient head to toe, they have done the lab investigation, everything is normal, so hence he is in a healthy state. They cannot explain these features of anxiety or out of harmony in the society. This lack of harmonious continuity connected with him constitutes the latent miasm. So, this lack of harmonious continuity or the feeling of this state of anxiety, being oppressed or being out of harmony is because of the latent miasms which the orthodox school of medicine failed to recognize. So many example cases are given regarding this. If you're interested, you can read pages 95 to 103. Now, the 11th chapter, application of the doctrine of miasm to the treatment of the patient. In this chapter, illustrations by clinical cases are given. The possible cyclical movement of the prevailing miasmic condition and its ultimate effect. Hahnemann gave the importance of the diagnosis of the dominant miasm in each case. This can be done to the symptomatology expressed by the patient. So, if you read this chapter, many illustrations have been given or many clinical cases have been given, and the possible movement of the miasmatic activity has been given from PSORA to psychosis to the syphilitic miasm, and importance to the dominant miasm is given. This can be done only through the symptoms of the patient. The old school always looks for the pathological diagnosis. So the orthodox school of medicine, they always the diagnosis was based on the pathology. By doing so, he will understand and act only upon the part of the disease. So if the old school of medicine or the orthodox school of medicine only has a pathological diagnosis, they'll be seeing the patient in a one-sided manner, only that part or that location or that organ which is affected. They do not consider the rest of the body. Whereas in homeopathy, we must consider the useful totality. Useful totality meaning the symptoms which are characteristic of an individual. Character symptoms on the mental plane and physical plane have to be taken into consideration. So this useful totality will comprise of the symptoms which are characteristic on both the mental and the physical plane. So case illustrations have been mentioned from page 108 to 110. There are certain advantages to defining the patient as miasms. So Ortega said that once we identify the miasms, it has certain advantages. Now let us see what are these advantages. Firstly, it spares us the failure of supposing that we are going to cure when we are scarcely going to succeed in the relative and fleeting elevation of the symptoms. So he says that in the cases which are not very well or in which the pathology is advanced, we are definitely not going to cure such cases, and we can only relieve some symptoms of the patient. So by identifying the miasm, we can understand whether we can cure the patient or whether we will not be able to cure the patient. For example, if the psoric miasm is there, as you all know, it's a deficiency state. There are no pathological changes, only reversible functional changes are there. Then you can know it is a curable disease. Whereas the syphilitic miasm, you know, there is destruction and degeneration on the mental level, on the physical level, as well as on the pathological level. So we will not be able to cure such cases. It enables, second point, it enables us to understand the profound pathology which we must inevitably confront sooner or later, and which is our duty to bring to the surface so that it will be accessible to the correct treatment seeking a true cure. So the miasm will help us to identify the pathology. So once we identify the pathology, then only we will be able to give the correct treatment. So as I just told you, in a psoriatic case, the pathology is reversible. In a syphilitic case, the pathology is irreversible. It gives us an unshakable basis for a relative prognosis of the case considering it all profoundly and going into the constitutional management factor, which have determined the series of dysfunctions and lesions. So the next advantage is that by knowing the miasm, we can also come to know the prognosis of the case because of the miasm present at the background. So if again, if a psoric miasm is present at the background, prognosis is good. If syphilitic, it is bad. If a psychotic, it depends upon the pathology. If it's a reversible pathology, it will be fine. It will be good, the prognosis. If not, the prognosis will be bad. So the miasms help us to detect the individuality of the patient. So another advantage is that it will help us to detect the individuality of the patient. Each miasm has its own set of characteristic individualistic symptoms. We must verify the extent of the psoric imprint of deficiency. And also, if a psoric miasm is present, it has an imprint of deficiency, which we must be able to perceive and rectify the deficiency. We must perceive everything which psychosis excess has impressed upon succeeding generations and penetrated into its depth. So when the psychotic miasm is present, we must see what traits of the psychotic miasms have gone into the generation of the family, and also at what depth it has gone. We must know by intuition to what degree the syphilitic miasms perverted the spiritual and the organic life of the individual. So when the syphilitic miasm is there, we must know what are the pathological changes taken place in an individual which will have the perverted signs and symptoms. The homeopathy physician must also be able to perceive suppressive effects and its subsequent consequences. So Ortega said that the homeopathy physician is the only physician who will be able to perceive what effects are there in the body which have been suppressed, and what are its consequences of the suppression and how to overcome it. So that's all. The chapters 12 to 15 will be coming up soon. If you haven't still subscribed to my YouTube channel,